Very good morning, Director Sir. Shall we start the session?
The recording has stopped.
Good morning, sir.
Yes,
Good morning.
Yeah, so shall we start the session?
Participants, how many participants are there?
So right now, so total 31 with panelists and only 23 participants are there in the session.
No, send the message to quickly join in all the three groups.
Okay, sir. Okay.
And Suren sir, are the students who join? Till then, you can start introducing and other things.
Okay, sir. Okay. Yeah, very good morning to all of you. Push yourself because no one else is going to do it for you. With this motivation, I, Dr. Payal Bansal, welcome you all on the behalf of Poornima College of Engineering in this 5th International IEEE Conference, ECRI 2020. This is the third and last day of this conference.
Santani sir, you
For
need to
enhancing
adjust
our
your
knowledge.
camera. Santani sir. Santani sir, you need to adjust your camera.
Yes, sir. Yes, sir. Sir, is it now clear, sir?
No, you are half visible. Half face is visible here. You should be fully visible, na?
Yes, sir. Yes, sir. Yes, sir.
Sir, may I continue?
Yes, yes.
Okay, sir. Okay. Yeah, we are having very great personality, Professor Noori Tawadi Mohammed Tahir with us for her expert talk. Very good morning, ma'am.
Good morning. Thank you. Good morning, everyone. Good morning, Dr. Mahesh and everyone. Thank you.
Yeah. Her topic of talk is the future of gait analysis and classification. Before going to start the session, let me introduce our Professor Mohammed Tahir ma'am. Mohammed Tahir ma'am is currently the Director of Research Nexus UITM and entirely under the portfolio of Deputy Vice Chancellor of Research and Innovation of UITM office that leads the university's research and development agenda in promoting high-impact multidisciplinary research. She received her PhD from the National University of Malaysia, UKM, and the Masters from University of Liverpool, UK. At present, she is the chair of IEEE IA Malaysia chapter. She is also one of the Stanford Faculty Fellow Program conducted by Stanford University, US and Malaysia, Global Innovation and Creativity. And here she experienced the entrepreneurship education program in Stanford as well as Silicon Valley and entrepreneurial ecosystem. As a researcher, she has received more than RAM 5M research grants as principal investigator as well as collaborators. She has awarded 16 PhD or 9 master students have graduated under her supervision. Her research interest is in the field of image processing, pattern recognition, and computational intelligence. She has authored and co-authored more than 250 journals and conferences, articles also. It is a great honor to having such a renowned personality between us for her expert talk. I welcome you, ma'am. Before starting your session, I would like to invite our director, sir, Dr. Mahesh M. Mundele, to welcoming you. Over to you, sir. Shivraj, sir, it is requested to you kindly mute yourself, sir. All the voice is coming.
Yes, just a minute. So I welcome Professor Dr. Nuritawati Muhammad Tahir from Malaysia. It's not visible right now. Yeah. So I welcome Professor Dr. Nuritawati Muhammad Tahir, who is Director of Research and Research Nexus, UITM, Malaysia. And thanks very much for accepting our invitation to deliver the plenary talk in ICREI 2020. Thank you, madam.
Thank you. Thank you, Dr. Mahesh, Director of Poornima College of Engineering, as well as Miss Payal. Shall I address you for that introductory session now? Yeah. Good morning and good day to all participants, panelists, and presenters of ICREA 2020 with this year theme, Recent Advances and Innovations in Engineering, organized by Poornima College of Engineering. And I would like to congratulate everyone for being able to embrace the awkward due to the pandemic faced by the whole world, and for having these virtual sessions. I can say it successfully. This is the last day today. So this is more like a sharing session of part of our research team here. In UITM. We are located like 20 kilometers from Kuala Lumpur. We're in Shah Alam, and we're a very big campus. Dr. Mahesh knew about this, okay? Because last year, ICRA 2019 was held in one of the branch campuses in Kedah. So allow me to share my screen now, my slides.
Yes, you can share.
Yeah, ma'am, over to you completely. Please share your screen.
Yeah, sure. I'm doing it now. Yes, madam. Okay, I'm going to please inform me if you can't see the slide clearly.
Yes, it is visible.
Okay, thank you. That's good. Okay. To begin with, this is where we are. We have 14 branch campus. So that's me. You can call me Nurita. And today is more like a sharing session of what we have done in our research related to Gait and what's the way forward for maybe the youngster or the students or the postgraduates would like to explore the future of Gait. Yeah. Okay. For the first one, as an introduction, I'm going to just give a brief definition. So what is Gait actually in the medical term? What do we mean when we talk about Gait pattern, and what is it the diagnosis when it comes to the deviations or the abnormality in Gait? So from the word meaning Gait is actually the way we walk, okay? The manner of our walking, and it is actually a highly controlled, coordinated, and a repetitive series of our limb movement, especially the lower limb movements, whose function is to advance the body from place to place with minimum expenditure of energy. So Gait, when it comes to medical, it means to describe the human locomotion or the way that we walk and how it is as the locomotion is achieved through the movements of the limbs. Yeah. As for different gait pattern, it is actually characterized by differences in limb movement patterns. Therefore, each of us individual, we have actually a unique gait pattern of ourselves, where while there are some features in one person's gait that are common for everyone. I mean, we can actually, when we see one from far ahead us, we can know whether it's Dr. Mahesh or Norita or Payal, you know. But so now we are going to try when we observe via our vision. Yeah, so now what gait analysis and classification is all about, one of it is to make the computational and algorithms, yeah, recognize and identify the gait. That is one of the one of the research area in gait if you would like to explore in terms of biometric. Yeah. So when we talk about gait deviation and the diagnosis of the abnormality of gait, first we need to know the awareness of the functional limitations. This includes due to accident, injury, when you grow old, your gait changes because of the weaken of our limbs. Yeah. How the gait analysis system is trained to analyze and identify this deviation, and for us to be able to use the information appropriately to treat for the treatment of the regimen. Yeah. So when we talk about gait cycle, what is it actually? So one gait cycle is actually the movement of a single limb from the heel strike, okay, or known as initial contact, to the next heel strike. So these are the subdivision of gait cycle by the stance phase and the swing phase. Yeah, it has the initial contacts, and when we talk about stance phase and the swing phase, stance phase begins at with initial contact, yeah, initial contact of heel and ends with the toe off. Okay, that is actually the stance phase. And initial contact occurs at 0% and 100% here, okay, of gait cycle, and toe off occurs at 60%. And when we say stance phase 2 is about 60%, and swing phase normally is 40% of the whole gait cycle. So that is actually the subdivision of gait cycle, which is the stance and swing phase. Next, stance phase can be further divided into 5 categories, which is the first one is the initial contact here, yeah. So initial contact occurs at 0% of our gait cycle, and the main objective of our body, the principal objective of our body is to position the foot correctly as it comes in contact with the platform, with the floor, yeah. So body is about to begin to decelerations. Okay, that is actually the initial contact. The next one is the loading response, which occupies 0 to 10% of our gait cycle, and it maintains the smooth progression while decelerating up the body mass as it travels. Yeah. So at the mid stance of opposite limb, and when the opposite limb toe occurs at the end of the loading response. Yeah. So this is a period of double limb support. Yeah, that's the stance phase. As for the mid stance, the third one, it utilizes the momentum to maintain stability of our hip and knee, yeah, the lower limb, while advancing the body over a stationary foot. And with the center of gravity has reached its zenith and forward velocity at minimum. So initial swing has begun on the opposite side of our foot. Okay, for the fourth one is the terminal stance, yeah? The terminal stance here, which occupies 30% to 50% range of the whole gait cycle. It provides acceleration and to ensure that, you know, the step length is adequate, and acceleration is provided by the forward fall or the center of mass of body, and this constitutes like around 80 to 85% of our total energy generated. And the fifth one is the pre-swing, yeah, which occurs 50 to 60%. Remember, yeah, stance phase, it has 60% of the overall gait cycle, and another 40% is from the swing phase, yeah. So this is where the period of double limb support, and you know, the goal is to prepare the limb for the swing phase. And the initial contact of opposite limb marks the beginning of the pre-swing. So that's it, stance phase. So we have three. Next is the 40%, which comprise of the swing phase, when the limb is off the ground, and it can be divided into three, which is the initial swing, the mid swing, and the terminal swing, yeah. So for the pre-swing, I mentioned pre-swing just now, upon completion of stance swing, which occupies 50 to 60% range of the gait cycle, yeah. And now with the swing phase, which 60 to 70% is comprised of the initial swing, yeah. With the critical function is to allow the foot clearance, okay, and the variable cadence, requires control and precise timing of two joint muscles. We don't actually aware of it because it's actually we naturally walk, you know, but when you want to explore gait analysis, these are the features of details, parameters of gaits that we need to know, and you know, these are the actually the gait parameters and features and that we analyze, okay, as part of the analysis in whatever field of gait that we explore. So mid swing, the next one is mid swing, which occupies 70 to 85% range of our gait cycle, to maintain foot clearance, yeah. Foot clearance actually depends on maintaining a relatively level pelvis, sufficient hip flexion, and adequate ankle dorsiflexion. So those are the terms, okay, flexion, dorsiflexions, everything. So in normal gait foot clearance, okay, it's around less than 1 cm of our ankle dorsiflexions, yeah. And for mid swing, yeah, sorry, for terminal swing, that is just now is mid swing. Now is the terminal swing, which occupies the remainder 85 to 100%. Everything is 40%, yeah, swing phase. So 85 to 100% range of the gait cycle, and the function is deceleration of the shank and correct pre-positioning of our foot to the contact to the floor, and it's the complete knee. This part, yeah, is the complete knee extension and neutral position of foot, which are quite critical for heel strike. So that's the stance and swing phase. In linear measurements, when we talk about temporal parameters and cadence, there are five features there, which is the step length, the stride length, the time, the cadence, and the velocity of walking. So among all, yeah, the one that is potential to be explored is the kinematics features, yeah, the kinematic gait features that involve the movement of pelvis, movement of our hip, the knee, and the ankle during stance and swing phases, the one that I've mentioned earlier, yeah. So there are three planes that we can utilize here for gait analysis and classification, which is the sagittal, the coronal, and the transverse. So kinematic actually denotes the movements observed and measured at this four, which is the pelvis, hip, knee, and ankle, yeah. And I've mentioned it can be in either of the three planes. So this is one example of the plots that normally we analyze, yeah, for the pelvis and the hip during stance and swing, which is the sagittal plane, yeah. So the pelvis normally, the pelvis tilts are the one that we focus, yeah, here the pelvis tilt, which normally approximately around 15 degrees when it comes to walking. So these are the features that we extract and we analyze. So as for hip, yeah, during stance and swing, yeah, during stance is the flexed at initial contact, then extends fully, and during swing, it involves the hip flexors rapidly to pull the stance limb off the ground. Okay, so those are the which is the toe off. Those are the things that we extract information and the analysis that we conducted. I mean, the experiments and the analysis that we conducted. So next, remember I mentioned pelvis, hip, knee, and ankle. So when it comes to sagittal plane with knee, yeah, when we talk about stance, it's actually the initial contact knee flexes at 15 degrees and then it extends. And the swing is at the heel rise of the knees, yeah, that begins to flex again upon reaching maximum during pre-swing. And the remainder is actually when the knee, when the swing knee extends accordingly. Yeah, this is the plots of the knee flexion extension during stance and swing. Okay. And the fourth one is the ankle during stance and swing. So when it comes to ankle during stance, is where the neutral at initial contact, yeah, neutral at initial contact, then plantar flexes around 5 to 10 degrees at forefoot, comes to rest to the ground, and where the ankle actually dorsiflexes throughout the mid-stand and move forward over the plantigrade foot. Yeah. As for the ankle during swing, actually, it's during the terminal stance. And the pre-swing is where the ankle plantar flexes and heel rises to prepare for push-off. And the dorsiflexion, yeah, the dorsiflexion to the neutral position here, as seen. Yeah. So that's the sagittal plane. The next plane, remember there's 3 planes that we can investigate and explore. The next one is the coronal plane, which is that involve the pelvis and the hip as well. Here, each hemipelvis rises slightly during swing phase. Yeah, stand phase hemipelvis drops slightly. So that's the detail of the pelvis. So accentuated pelvic, yeah, drop in swing can be seen in the Lumbar Gate. So that's one example of it. So as for hip, during the stand phase, it's slight adduction occur, while during the swing phase, abduction is observed. So these are the plots that how we actually compare the abnormal or the normality within groups when we go for pathological gait. Yeah. So the third one is the transverse plane that measure rotation. Pelvis and hips rotate, and how it is being rotated. Actually, it's being rotated very minimal, and the tibia has a fixed external rotation. So that's the 3 plane that we have shared. So these are some example of factors affecting our gait. So the factors affecting our gait includes age, you know, as we go older, yeah, especially the elderly. They have some of the elderly, they have trouble to balance their walking gait, and normally, you know, the falling while walking, yeah, maybe because of the unbalance, or maybe because of the weight, or maybe it's already the lower limb is weakened, yeah. So because of height, yeah, size and shape of certain of our body structure, which is our bone components, bony components, the muscle strength, maybe during carrying of bulky items, yeah, that's some of the factors, and due to physical injury, yeah. So these are some of the example of factors affecting gait. As for gait deviation, what causes gait deviations? Maybe due to pain. You know, your leg is injured and you start walking, you know, limp, weak of muscle, like I've mentioned earlier. Abnormal muscle activity. This is normally the cerebral palsy, the autism kid, the Parkinson disease subjects, yeah, or maybe due to some abnormalities in our joint, yeah, and also the limb length of certain bodies discrepancies, yeah. So these are some examples of tiptoe walking that do occur in some of the infant and the young children. So these are more examples on gait deviation. I'm not going to read all. I'll just explain to you briefly that I'm looking at the time now. Okay, is actually the stun phase avoiding antalgic gait. The stun phase avoiding bearing on the involved limb, short limb gait, dipping on shoulder and pelvis, yeah, on the affected side. That includes flexion of the hip, the knee, and the ankle of the opposite limb, yeah. So lumbar gait I have mentioned earlier, yeah, it's something to do with the pelvis drops on opposite side. Waddling gait, where patient actually lurches on both sides during walking, yeah. High stepping gait involves the flexus foot and knee excessively to clear the ground, yeah. Scissoring gait is one of it, under gait deviation that involve one leg crosses directly over the other, yeah. It's something like that when they walk. That's called that is known as the scissoring gait, yeah. So calcaneus gait that involves walk on broadened heel, yeah, with tendency to external rotation, and is actually no calcaneal pickup and during push off, yeah. Stiff hip gait is actually the movements due to affected of the hip, excess movements in the spine, okay, and stiff knee gait, yeah, no flexion at knee, so the pelvis needs to raise during swing, yeah, okay. And the next one is the gluteus maximus gait, where patient normally lurches backwards due to the weak gluteus maximus, yeah. And the medius gait, gluteus medius gait, is like similar to this one, the lumbar gait, yeah. And another example is either the quadriceps or the hand to knee gait. This is where the patient stabilize the hips and knee for weight, yeah, bearing by leaning on affected side. No, you start to walking this way and pressing over your lower thigh, okay, by your hand, by your own hand, yeah. So that's some example of gait deviation. So the potential of application of gait technology is in security, in medical, in sports, yeah. When we talk about security, it involves biometric as well, but not yet, yeah. It's not as that full. I mean, the database is not that big yet. Maybe it can be controlled in a small offices or laboratory for security purpose, yeah. Okay, so now I would like to narrow down on what is related to our research area that we have done here in UITM when it comes to gait. We actually explore the development of gait in children, which is actually the toddler's walking pattern. Okay, so toddlers walking pattern involve a wide-based gait that increase the flexion of hip and knees and arms held out to the sides. You know, normally they wants to balance their walking style, you know, they are still small, the kids, yeah. And before it reaches the stable velocity pattern, where normally it's around 5 years of age, the child has developed a stable velocity pattern, and by 7 years, okay, it has actually attained the adult gait pattern. So this is some guide, some not to say the rules of thumb when you want to explore something on gait deviation that involve children. Yeah. So when we talk about gait analysis, what is it actually? It's actually a systematic description and assessment of qualities that characterize the human locomotion. Mainly is used as a pre-operative planning and documentation for post-operative outcome in patient, for example, like I've mentioned earlier, cerebral palsy, autism, Parkinson's disease, strokes, accident in the elderly, injury, as well as sports performance. Yeah, so that is gait analysis, and I'm going to focus the one that we have. The one that we are doing recently, which is the anomaly gait detection in autism spectrum disorder children using the markerless model approach. Yeah, and we check and we come up with a very initial stage of markerless model approach. Yeah, when we talk about markerless, is something that is not using any markers. You know, we don't put it here in the body. Yeah. So just a brief introduction. I think everybody know what is autism. It's just when it comes to gait, what is it actually? It can happen a development disorder when it comes to autism spectrum disorder. It is actually a development disorder that can be characterized by several difficulties, learning process, communication, social skill, and it can be from mild to severe. Yeah. So there are special tools actually being used to rate the ASD. It is known as the Childhood Autism Rating Scale, or CARS. Yeah. As well as another one is the GARS is the if I'm not mistaken, Gilliam Autism Rating Scale. These are the tools that are being used to diagnose ASD or vice versa. But as of now, there are no specific tools being used as indicator to detect some abnormality disorder when it comes to gait. Yeah, so that's why many researchers actually are exploring this abnormality of gaits, be it in autism and some other special kids. Yeah. So on top of that, autism is not about vaccine. Everybody knows that. There is no cure for it, but it's just how we as guidance or parents handle the special kids. Yeah. And for them to have a better quality of life. That is the purpose of it. So many studies actually is being done in gait analysis, especially for these autistic kids that have been used or been able to identify the differences between the gait characteristic of the autism kid versus the normal children. Yeah. So what we have done here in our research group, yeah, we have actually these are some of the gait techniques, yeah, that is able that can be used to experiment the autism kids. So here is actually a 3D Vicon motion system lab that we have in our university that we use as a gait acquisition technique. That gait acquisition technique can be divided here by several categories, and the two techniques, namely the sensor-based category and the vision-based application. So the differences is actually the gait acquisition technologies, whether it's wearable sensors, whether it's the floor sensors, or the marker-based, or the markerless-based technique. Yeah, or it's possible to be a combination of any of those that I have mentioned earlier. And on top of that, gait study also is being used and exploited application of gait techniques. Yeah, by now, why we're going for markerless actually, it's quite challenging to bring these special kits to the laboratory when we go for marker based, like what is in the image here. Yeah, it's not easy for them to be at an different situation because these are the special kits. Yeah, the parents and the teachers needs to be around. We need to repeat the experiment several times, many times, and it has to be when they are ready because they are very fragile. You know, they are not used to the normal environment. They are not like normal kids. Yeah, so it's good if we can have one markerless based technique or potential markerless based approach that we can utilize to detect the abnormality of gait in these special kids. Yeah. So our research methodology comprised of that 5 element. We begin with data acquisition, yeah, followed by we process it, yeah, and feature extraction. Then we propose one very initial stage of markerless based approach that could be further explored and strengthened, yeah, for the purpose of markerless based technique. So for data acquisition, yeah, these are the, I've mentioned to you, these are the system, the Vicon system that comprise of a depth camera sensors, yeah, that actually we conducted both. Okay, when the kids came to the lab, one is using the marker base and one we use the depth camera for the markerless. So we want to compare both marker base and markerless base, and from there we'll try to find what is the similarity between both that we can adapt in the markerless base. Yeah. So the gait data were extracted from these two groups of subjects. The autism kids, around 22 of them, 22 of them, and the normal kids, around 30 subjects. Yeah, the age ranges from 5 to 12 years old. Okay, and as for the autism kids, yeah, the earlier identification and diagnosis is in the mild category that is medically confirmed by the medical practitioner. We take the mild category. We don't take the severe. Okay. So ours, the 23 it's 23. It's 20. The 23 ASD is the mild category. So of course we got the ethics approval from the university. Okay, and we conduct it in our human motion and gait analysis laboratory in UITM. Yeah. So as for data pre-processing, those are the proposed markerless and marker-based technique. Okay, and these are the plots that we attain, yeah, from the experiment. Is actually the gait feature algorithms that we derive from the gait data of the proposed method. Yeah, from this we develop the algorithm, where followed by the processing. Yeah, based on the two types of gait techniques that we extract simultaneously during the walking trial, and From there, we go further to feature extraction, sorry. So for feature extraction, actually we utilize PCA and LDA, yeah. I think everybody knows what is PCA. We utilize all three rule of thumb of PCA, which is the cumulative percent variance and the scree test and the eigenvalue of cumulative, and from there we extract the significant eigenvalues, okay, followed by the linear discriminant analysis as well, yeah, and upon completion of feature extraction is the gait classification. Actually, 4 different types of classifiers are being used: support vector machine, the naive Bayesian classifier, the artificial neural network, and the long short-term memory. So this one we have not yet utilized the deep learning because of the database, yeah. The database is quite small, which is 22 and 30, yeah. That will be our future work to be considered. Everybody is going for deep learning now. So from the results, I think actually the naive Bayesian classifier showed the most highest accuracy with 99, I think it's around 99% specific sensitivity, yeah, which means it can diagnose autism as autism, okay, and sensitivity, it can clearly recognize normal as a normal kid, yeah. So on top of that, we added one extra there where we evaluate and validate both methods, the markerless, the marker-based technique, yeah, that from all the 4 steps that we have done, and we relate it to the and we try to come up with what will be the feasible, viable markerless based technique that we can start establish or develop. So it involves statistical analysis and visualization of kinematic plots there, where actually, as I've mentioned earlier, both are captured simultaneously. And we can see that from the ANOVA and kinematic plots, yeah, this is from the marker-based technique. This is where we extract from the depth camera sensor, okay. It doesn't see any similar patterns, okay, from this ANOVA. And it shows there, from ANOVA that we conducted, it shows there is a significant differences, yeah, from these both techniques. So we explore further by using the intra-group normalization as well as the intergroup normalization. And from there, this is what we attain. Why is it not showing, yeah? Sorry. Okay. There are the patterns of the angle of the hips and the knee and the ankle shows some similarity pattern. That is what actually we want to see. The similar patterns for both marker base, okay, as compared to the markerless that we want to come up with, because we want to know which other gait features can be extracted, okay, for the markerless base purpose, yeah. So in this last section, what we have done is actually the evaluation and validation between the gait technique we have conducted. So it is shown here that the kinematic features, specifically the hip, the knee, and the ankle angles, we evaluated the patterns, yeah, and we confirm with the inter and intra-group normalizations, yeah. So from the plots, it is observed that the hip and ankle angles, these two, hip and ankle, yeah, exclude the knee, showed noticeable different shapes, yeah, between the two gait techniques. Okay, so when we normalize it, the patterns of the plots are similar, yeah, here. Okay, sorry, here. Here, exclude the knee, the hip, and the ankle. We can see the similar patterns there. So from there, we conclude that it is possible for us to have that very initial results to confirm that it is possible to have that markerless base technique, yeah, based on that, which is actually less experiment protocols, and we are able to extract the gait features automatically and potential to be used as diagnostic techniques, okay, in facilitating post-therapy program, yeah. So, okay, so some parts of recommendation for future work include, what we have done, we have explored the kinematic feature from the sagittal. Maybe we can go and proceed with the anatomical plane. Okay, using a multi-depth camera, we have utilized only one, yeah, and explore spatial temporal and kinetic that is not yet being investigated, yeah. And also, and like I have mentioned earlier, using deep learning neural network. So let me, before I end my talk, actually, normal gait is designed to be efficient and all the priorities are met. So when we talk about abnormal, there are something, you know, not correct about it. So studying the human gait actually has enabled us to define and document and analyze normal and abnormal human gait more accurately. So that's it. That's my talk. With that, thank you. Yeah, it's what time is it? Over there.
Yeah. Thank you so much, Pam. Thank you so much.
I think I'm just 5 minutes early. Yeah.
No issue, ma'am. May be possible that some participants have some query.
Yeah, sure. Thank you.
If any of the participants have any query, then please ask your query by unmuting yourself. Ma'am is here with us. Any one of you, please. Please write your queries in question answer box.
I'll stop sharing this so that I can.
Yeah. If any participants have any query, please ask your queries.
I want to see if there's any questions in the chat box.
I think no more queries. Thank you so much, ma'am.
Yeah, this is some of the way forward of GATE that maybe, you know, the students or maybe researchers would like to explore in their future GATE.
Yeah, ma'am, definitely. Your views, your ideas definitely will help the researchers and the scholars and faculty also like us to enhance our research area.
There's never end in research.
Yeah, sure. Absolutely right, ma'am. Absolutely right. Okay. Thank you so much, ma'am. Thank you.
Thank you.
I'd like to invite our director, Dr. Mahesh Bundele, sir. Sir, please say a few words of thanks. Director, sir. I think. Ma'am, just give me a second. Yeah, Santani sir, might be sir is busy with the meeting. So please say thanks to ma'am.
So my humble request that you maybe invite Praveen Somare sir also to give vote of thanks instead of director sir if sir is not there. No?
Yeah, I'd like to invite Dr. Praveen Sonwane from electrical department to propose the vote of thanks to ma'am. Yeah.
Madam sir connect ho rahe.
Okay. Thank you, sir. Ma'am, we can understand the situation. This is the online platform and such type of small issues are always there. Yeah, that is here with us.
Yeah. So I think the participants must have enjoyed. There were questions from participants.
No, sir, till now, no more queries from the participant side.
Oh, looking into Gait analysis, might be they are not aware of. So means otherwise, it's very important topic for
Yes,
engineers also these
yes,
days.
ma'am has said same thing. The topic is very vast for the research.
Yeah, it's a topic is vast and it is a general topic in terms of human health and human behavior and all those things. If you want to go in depth and do research, engineering research for that, so it is very important topic, and that's why I asked Madam to deliver this plenary talk here. Thank you, Madam, for your yeah. Thank you.
Thank you so much,
Did
everyone.
you take a group photograph?
Oh yeah, yes, for remembrance.
Yeah.
Yes.
Yeah. It's requested to all the participants and panelists, please turn on your cameras for a group photograph. Please. Yeah. Ready, sir? Can I take photograph?
Just a minute.
Yeah. Thank you, ma'am. Thank you so much.
Thank you. Thank you, everyone. Thank you. Have a nice day. Yeah.
Thank you, ma'am.
Yeah. Thank you, Dr. Mahesh and everyone.
Yeah.
Thank you.
Thank you.
Payal. Thank you, Pravin. Thank you, everyone.
Thank you.
Yeah.
Thank you. Thank you.
Yeah. Bye-bye. Bye-bye.
Bye. Bye.
Bye.
Shivraj sir, we can stop the meeting.
Shiraz sir, 1 minute, sir. One announcement for the electrical participant that you must join the Google Meet link immediately, as we are going to prepone our session from 11:30 to 11.
Electrical and computer will be also starting soon.
Okay. My humble request to all the participants of electrical engineering track 3 that please join Google Meet link immediately, as we are going to start our session now instead of 11:30. It is preponed from 11:30 to 11. I have also given the message to WhatsApp group also. Please join immediately. Thank you.
CS track also, I think they should start. Surendra sir?
Yes, sir. We already informed to the all participants. Again, you all are requested to please join at 11:30.
No, before 11 you can join if it is possible to start. If session chair agrees.
Okay, Shivraj sir.
शिवराज जी, बात का 1:30 से 2:30 का सेशन है, तो 1 बजे शुरू कर देना शिवराज जी।
सर मैं उनको कॉल करता हूँ।
हाँ, 1 बजे शुरू कर देना, बोला जूम 1:15 बजे।
ओके।
हाँ।